What are you going to do with the specialties? This is near and dear to my heart. This is the part I love. That once you go ahead and clear the room out, so you get the clutter out, so that you have room to breathe, now you can take the specialty items that you have, no matter what they are. Okay, I'm opinionated. I personally think that thing is a waste of money. Okay, I hate these things. I told you I'm opinionated. But the fact of the matter is, it doesn't matter what you want. Whatever you want, just make sure you can get it to where you need it, like instantaneously. I mean, I don't capsule mix anything anymore. I consider capsule mixers stupid. I just, like, you've got an auto mixer that, like, somebody patented the little thing, though. They made $1 zillion, way more than you or I are ever going to make on the little mixer thing. Okay, it's brilliant. Okay, you can throw the tip out. It's way cheaper than making a capsule of something, and you can have it anywhere. But if you want to have, you've got something that you've got to have mixed in a capsule, okay, be able to get the capsule mixer to the room, because chances are it's not something you use all the time. If it is, then you got to figure out enough room in the treatment room to go ahead and have that. In fact, in part, these giant things like capsule mixers were the reason we had all those countertops before, and that's all gone away. So here's what you do. Convert to highly mobile carts with power supplies. When I started doing this, I went to the local Office Max or something, and I bought something that was mobilizable. It was really meant to sit next to somebody's office desk. It really wasn't meant to run down a hallway and zip into a room in 45 seconds, which is the maximum time I'm going to tolerate. Like, so when I ask for a specialty procedure, when I'm doing I think I'm doing a crown, now I'm doing a root canal, I'll be honest with you, my time to convert the room is 27 seconds. And so if it doesn't convert, like, I'm getting impatient at 27 seconds. I'm not proud of that. Like, don't probably share that. But 45 seconds, you should be able to mobilize anything in any room. To do that, you need something robust enough that the wheels don't come off when it's going down the hallway. Ask me how I know, because those Office Max ones don't do that. Then what you want to do is you want to organize by the use group. So endo has a use group. The technologies for endo need to be in one place. If you implants, same thing. Ortho, same thing. If you do sedation, you may have the sedation monitor and your rescue products in the same place. They nest in logical groups. And then you want to make sure that you've got clear access for those to be able to be deployed. So if you think about it, since everybody's got specialty equipment nowadays, even if you're not doing this, somebody's got a CEREC. As soon as you roll it in, it's in the way of those drawers. So you can't use those drawers anymore. So don't have the drawers, because there's only going to be more technology, not less. So I want a place that's convenient for these to deploy from, so that they can get into any room. So everything goes back here, so we know where they are at all times. So just this is an example. Someone that came in for a hygiene check, has a light reading, a low reading on a diagnodet, needs an air abrasion. Well, it costs me about $28 just to sit somebody down, make an appointment for them, handle the phones, sit them down in a room, do nothing, and turn the room around. If I can go ahead and I don't know what a one surface filling costs, $100 to $200, like, we're not going to really make any money if I've got to make a new appointment, chew up a half hour or 45 minutes of time in a schedule to go ahead and treat that patient. So I want to be able to deploy that microabrasion immediately in the hygiene room. And then this will allow me to come in and do that procedure. You know how little time it takes to actually do it. The patient's thrilled because the patient is then able to go ahead and not have another appointment. So anything you can do to go ahead and simplify, and that's what rapid mobilization does. Again, you want to organize that by use groups, so CEREC fits into the same category. So there's scanning, endodontics, sedation and rescue, and orthomobilization as an example. We have more than that in our practice, but that's a good start for many practices. I mentioned that the room size can be smaller. And so I should just touch upon this because it's really the clear hallway size that you need. Dentists are many times afraid to make the room smaller. But if you look at this diagram, you actually see that a larger room with side cabinets actually feels and operates with less size than a room with the blue lines, which are with the cabinets, side cabinets out, but the room actually smaller. So many times, although we make offices smaller, it's not the reduction in room size. That's a relatively small amount, probably 15% of the room reduction. The reason that we're able to make offices when we redesign them as much as 30% smaller is because they run so much faster. As they run faster, the productivity is much higher. And so if you think about flow of water through a pipe, if the flow rate is higher, the size of the pipe can be smaller for an equal level of flow. So here is the effective width of that room. And there's the wider effective width once we clear the pathways. So you need to be careful about that. There are some rooms that are just too congested. And let me tell you, the patients don't love being in those rooms. So mobilization. I would have spun the thing around before I brought it in the room, but that's a trivial point.